Hi, my name is Justina Zolikoff, and today I'm going to be talking a little bit about bipolar disorder. So, to begin, for a little bit of an introduction, bipolar disorder is a mental health disorder which causes intense mood swings, including both emotional highs and lows. There are also different types of bipolar disorder depending on exhibited symptoms, including bipolar 1, which includes manic episodes and psychotic situations, and then bipolar 2, which is hypomanic episodes, not requiring hospitalization and without those psychotic episodes. I chose to focus on this disorder because there's a lot of misunderstanding and a lot of stigma around it. I found it interesting to get a deeper understanding of the illness and to just be able to better understand the symptoms and treatments of it. So, to begin, the symptoms of this disorder, there are two different types, bipolar 1 and bipolar 2. Bipolar 1 is a little more severe, with the criteria of having at least one manic episode with the following symptoms, which include an abnormally elevated, expansive, or irritable mood for at least 1 week, and then that mood must be severe enough to require hospitalization or, like I said, those psychotic features. And it must include three or more of the following criteria, as you can see listed here. Again, just a lot of high energy and kind of that increased mood, self esteem, that kind of thing. And then bipolar 2 symptoms, it must meet the criteria for one hypomanic episode and one depressive episode. Hypomanic symptoms, those include, or it results in a change of functioning, which is a little different than their normal behavior. A disturbance in mood and change in functioning are observable by others, so people notice it. And then again, this episode is not as severe to result in hospitalization and without those psychotic features. So, a little bit about the treatments. There is medication, including mood stabilizers, atypical antipsychotics, and antidepressants. The antipsychotics include lithium or valproate, and those help with preventing mood episodes or reducing severity of the episodes. And then antidepressants, which are usually used with an antipsychotic to help those low episodes. However, if they're used alone, it may trigger a manic episode. So, those are always used together to treat bipolar. There's also therapy treatment, including cognitive behavioral therapy, family focused therapy. There is a large focus on interpersonal relationships when treating bipolar disorder. And then interpersonal and social rhythm therapy. This works with an individual's biological rhythm to treat symptoms for their own body. And then finally, lifestyle. There is some studies that have shown that regular sleep schedule can help, as well as exercise, dietary supplements, and yoga to manage stress and to help keep those symptoms under control. And then finally, peer support groups help as well. So, a little bit about the race and gender impact on diagnosis. I chose to focus on the connection between African American males. So, bipolar disorder is often misdiagnosed in this community as schizophrenia because they exhibit these psychotic episodes, and there's ultimately a connection with schizophrenia, which affects the treatment. This is a result of conscious and unconscious bias in the medical community, and it is actually discovered that there's the same prevalence of this illness as there is in white men, even though the diagnosis rate has been different in history. This is treated with major tranquilizers when diagnosed with schizophrenia rather than lithium, which is proven useful when treating bipolar disorder. And then finally, it results in more neurological problems due to incorrect medication use. There's a lack of therapy support, and ultimately down the line, higher hospitalization rates because of the lack of treatment for this disorder. The impact of housing instability is important in bipolar disorder. There is a global housing shortage, which means there's a lack of adequate housing worldwide, leaving people in overcrowded, bad conditions, which ultimately impact their mental health. These living conditions result in poor physical health, making it harder to handle mental illness and like a diagnosis like bipolar disorder. This also creates additional stress, which exacerbates the symptoms. Additionally, along with the physical symptoms, there is more financial struggles, meaning they may not have the ability to afford their medications, their therapy, and healthy food to care for their well-being overall. This also may disrupt social networks, meaning they may be homeless, they may not live with the same people, leading to isolation and a lack of support from loved ones, which, as I mentioned, that's really crucial for the treatment of bipolar disorder. A little bit about the trauma-informed factor. There is a large connection between childhood trauma and bipolar disorder. Many patients who have suffered from childhood trauma result in mood instability, and that may impact diagnosis and treatment of bipolar. It has been shown that those who have experienced childhood trauma are 1.85 times more likely to experience their first episode earlier and more severe of the disorder. So being aware of this connection is important in helping treat it. And then finally, a little bit about the stigma surrounding bipolar disorder. Patients may be labeled as dangerous, crazy, or unpredictable especially online, but in the real world, and that would affect how they might not be able to find a job, they don't believe in themselves, and ultimately resulting in social isolation and an increase in their symptoms. And family and friends may reduce support for the patient because they don't want others around them or outside of the family to know about the struggle they're going through, which makes it more difficult for the patient to recover. A nonprofit organization I found is called Hopewell. It's a therapeutic farm community in Middlefield, Ohio. This organization helps adults who have been diagnosed with bipolar disorder and other mental illnesses like schizophrenia. This is a living community, and it helps patients to develop necessary skills to manage their illness on their own. Their goal ultimately is to help them transition to more independent living down the line, and this organization gives them the skills to do that. There is both individual and group therapy sessions in this community. As you can see here, it's located in Middlefield, and I listed their phone number as well as their website, which has a form you can fill out to get more information. So finally, bipolar disorder is a complex disorder with multiple different factors impacting diagnosis and treatment. There's a lot of stigma surrounding the disorder, and that results in misdiagnosis and social misunderstanding. Community resources are really crucial to successful treatment and recovery for individuals. And then a final takeaway is there's still a lot more to learn about bipolar disorder and its treatment. Cultural awareness and empathy is crucial to providing treatment and support for patients. Thank you.